I now request Professor Bart Criel to deliver the keynote address.
Honorable guests and delegates, ladies and gentlemen, good evening. The Institute of Tropical Medicine is present here with a strong delegation. We are 5 people, and this is an indication of our attachment to the Institute of Public Health, but also of our interest for this conference on equity. However, before proceeding and saying a few words myself, I would like to say something on behalf of our director, Professor Bruno Grisels. He should have been here today, but unfortunately, because of family reasons, he could not attend. Nevertheless, he has taken the effort to address this audience in a video message, and before proceeding, I would like to invite you to listen to his words.
Honorable guests, dear colleagues, dear friends in India and from all over the world, I have the great pleasure to greet you from the Institute of Tropical Medicine in Antwerp, Belgium. I regret enormously that I cannot be with you today in Bengaluru due to private reasons. However, it gives me great pleasure to share a few words with you at the start of this important meeting. The Institute of Public Health in Bengaluru started almost from scratch in 2005 and has by now grown into a young, vibrant and influential school of public health that really puts its mark on health policies in Karnataka and in India. One of the main achievements is the organization of these meetings, such as today, that bring public health research into public health policies. I have been able to assist in one of these meetings some years ago, and I was truly impressed by the vibrancy of the exchanges, the pertinence of the ideas, and the impact of the proceedings on the minds of the people and of the policy makers that were present. I therefore really believe that this collaboration does result in better health policies and better health for many people, especially the poor. I look therefore also very much forward to continue this collaboration, probably more and more not just as a North-South collaboration, but as a South-North collaboration, in which the Institute of Tropical Medicine in Antwerp learns at least as much and probably even more from the Institute of Public Health in Bengaluru than vice versa. Even more important, we have been able to assist the Institute of Public Health in Bengaluru to collaborate and to lead even partnership with other public health schools all over the world, in Africa, in South America, in Asia and in Europe. We therefore believe that the future of this collaboration is most likely to become even stronger under the form of such a network, an alliance of public health schools with like-minded ideas all over the world. We really look forward to such collaboration, and especially to have the Institute of Public Health playing a leading role in this endeavor. Thank you very much. I wish you a very productive meeting and a very nice social program. I hope to see you soon in India, in Belgium, or somewhere else in the world. Thank you very much for your attention.
Well, I would like to join, and I'm sure my colleagues with me, to join our director in his words of praise for the Institute of Public Health. I have been myself personally a privileged observer in the development of the Institute of Public Health over the last 10 years. And to the extent of embarrassing them, I really want to say that their track record has been impressive. EPHP, the third edition, is a nice illustration of this, and I believe that EPHP has become slowly one of the leading events in the Indian landscape of health policy. My director has referred to the fact that we in Antwerp learned from India, and this makes me think of this beautiful concept of reverse innovation, where the North learns from the South. And I can tell you in Antwerp we learn in terms of e-learning, distance learning, etc., where the friends of IPH actually accompany us. The central theme of this third EPHP edition is equity, and I think this is very fortunate. Equity has been, as we all know, a central concern in the 1978 Alma Ata Declaration on Primary Health Care. In the 80s and the 90s, however, it was a bit pushed in the background, and a bit is perhaps an understatement, but it was pushed in the background in an era where efficiency was very prominent in international health policy. But equity is now back on the international agenda. And the work of economists like Wilkinson, Piketty, and others on the growing inequalities in our world have definitely contributed to this. The motivation for this increased interest for equity is, in my view, a mix of at least two things. First, there is a bit an opportunistic or even conservative rationale. There is the growing awareness that increasing inequalities are a threat to social cohesion and a potential source of major social unrest. And this makes me think of the parallel with the development of social security systems in European welfare states end of the 19th century and first half of the 20th century, where the political and economical establishment was afraid that people organized in social movements would overthrow them, and therefore they engaged into developing social security policies. Secondly, of course, and fortunately, there is an ethical and normative view that is an appeal for more fairness. Fairness is a word that one hears more and more, also in European and Belgian politics, even if not always with success. So this conference on equity in health is really very timely. Let me share with you one of my expectations from this conference. Lots of progress has been achieved in the last couple of years in documenting inequities in health. Dr. Gaffar has already referred to it, but it's clear that the tremendous work done by Sir Michael Mermet and his team in the frame of the WHO Commissioned report on social determinants of health has been key in this. We are today better equipped in measuring health inequities, and even in understanding some of the complex mechanisms that lead to them. As a public health professional, I remain impressed with the health statistics that, for instance, England and Wales can show. Many of them going back to the 19th century. Already then, gradients in health outcomes according to socioeconomic class were documented. But, and that's the point I want to make, these gradients may perhaps have reduced, but they're still there. Hence my expectation. We are indeed far less successful today when it comes to actually address health inequities, even if we know reasonably well what would need to be done. So in my view, the big challenge today is about implementing policies on the ground that make a real difference. We need to have more evidence on what works, why it works, and how it works, and in which circumstances it works. Among the difficulties is, of course, that action and change is only possible when there is political will to do so, but also because of the daunting complexity of the work to be done. There is no magic bullet, and there are no simple solutions. But I'm confident that this EPHP conference can provide us with inspiration and insights from the field on how to make a difference. Let me end with highlighting what, in my view, probably is the most powerful asset of the EPHP format. It is a forum that gathers academics, policymakers, politicians, health managers, frontline health workers, and people. We absolutely need this sort of chemistry if we want to progress. I wish us all a great conference. Thank you very much.